Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. This is a recording of the lecture on venipuncture equipment. This is part 2 of a 2-part lecture series. Please remember to like this video and subscribe to my channel for more medical laboratory educational videos. Again, this is part 2 of a 2-part lecture series on venipuncture equipment. If you've not seen the first part of this lecture series, please check that video out. I'll leave a link to it in the description of this video. Okay, so the evacuated tubes draw only the pre-measured volume via a vacuum that's inside the tube. So these tubes will only draw the specified amount of blood that will fill the tube, from 1.8 milliliters up to 15 milliliters. The amount of blood you need to collect is determined by the size of the tube and the amount of vacuum that's present within that tube. So when you select the appropriate size tube, you must consider the amount of blood needed for the test, the age of the patient, the size and quality of the patient's veins, and the gauge of the needle that you're going to be using. The tubes used in the evacuated tube system are color-coded. The color tells you what additives or anticoagulants are in the tubes. So the correct additive or anticoagulant is required for each test that's ordered. So this photo shows a variety of evacuated tube types. So each color on these caps tells you what additive is present in the tube, and we'll go over all of these today in this lecture. So the inside of the tube is considered sterile, and also it's silicone coated. Tubes nowadays are usually plastic. They're usually no longer glass to prevent breakage if a tube is dropped. The tube is labeled with the type of anticoagulant or additive, the draw volume, and the expiration date. The manufacturer of these tubes guarantees the integrity of the anticoagulant and vacuum in the tube until the expiration date. Expired tubes may be used during the course for practice. So if you are in a phlebotomy course and you're just practicing, you can use expired tubes, but they cannot be used for patient testing in the real world. So when gathering your supplies, you should check for the expiration date on all of your tubes. When drawing real patients, if the tubes are expired, they cannot be used. So again, if in practice for class, if the tubes are expired, you can tell the instructor during your checkoff, for example, I'm checking the expiration date, these are expired, or I'm checking the expiration date, these are not expired. So, and that's all obviously dependent on what phlebotomy class that you're taking. So in this particular course that I'm teaching, we will use expired tubes, but during the clinical rotation in the second course, expired tubes cannot be used. So it's good practice, of course, to use expired tubes when you're just learning how to draw, but when you're actually doing on a patient, you do not want to use expired tubes. So it's also good practice to learn the color code for the manufacturer that you use, as they may look slightly different with differing manufacturers. So we've already discussed that the tubes in the evacuated tube system are color-coded. The color tells you what additives or anticoagulants are present within the tubes. The color code is important, and you must learn it to be a good phlebotomist. So on this slide, you'll see two terms, additive and anticoagulant. An additive may help to preserve some part of the specimen, inhibit antibiotics, or help the sample clot faster. An anticoagulant stops the blood from clotting. A sample that is in an anticoagulant tube yields whole blood and does not clot. When a tube with anticoagulant is centrifuged, it will have red blood cells at the bottom and plasma on the top. A tube with no additive or a clot activator tube will clot. So if these tubes are centrifuged, the clotted red blood cells are at the bottom and the serum is on the top. So plasma has fibrinogen in it, and serum does not have fibrinogen because fibrinogen is used up to form that clot. So the type of sample that's required is dictated by the specific laboratory test requirements. So again, the color coding of tubes gives us a quick visual reference to what additive or anticoagulant is in the tube, and to keep the tubes in order more easily. It can also tell us if a tube needs more inversions or any type of special preparation that's needed. The picture on the right-hand side of this slide, or cartoon rather, shows something called the coagulation cascade, or it's also called the clotting cascade. As a phlebotomist, you don't need to know the steps, the pieces of this cascade, but of course medical laboratory technologists or medical laboratory scientists are required to know it. So in short, the coagulation cascade is a step of events that lead to something called hemostasis, or the clotting of blood. And different clotting factors are involved in this pathway to form a clot. So you can see in these kind of orange blocks on this picture labeled either heparin or EDTA, sodium citrate, potassium oxalate, and SPS. So these are the different anticoagulants that can come in venipuncture tubes. Heparin acts by inhibiting the action of thrombin, which is part of this coagulation cascade. The rest act by binding calcium, which is also part of the coagulation cascade. So by interfering with this coagulation cascade, it prevents the samples from clotting within the tube. The collection tubes have a safety shield plastic cap over a rubber stopper, which prevents blood from splattering when they are opened. The tubes must be filled to the designated volume. Volume requirements are more important in some tubes than in others. So for example of this, a light blue tube that is not full to the fill line will always be rejected, as it will prevent accurate results for the test run on this specimen tube. All tubes should be gently mixed by inversion, so gently mix them. Do not shake the tubes. Also, do not mix blood from one tube type into another, as this will cause the lab test to be invalid. So when collecting multiple tubes, it's important that they are collected in the correct order. There's a specific predetermined order. If the tubes are collected in the incorrect order, this can result in a bacterial contamination of culture tubes. It can also result in the carryover of an additive or anticoagulant from one tube to the next. Both EDTA and heparin can cause elevation of coagulation tests, PT or APTT, so those are specific coagulation tests. Therefore, the sodium citrate in the light blue tube must be collected before tubes containing EDTA or heparin. So the next slide reviews the types of tubes. You need to know the types of tubes and, of course, the correct order of draw of all of these. So this red, light gray, and clear top tube is usually a discard tube, and it does not have any anticoagulants or additives. So this tube is used when collecting using a winged collection or butterfly set so that it can remove the air in the tubing. It's important to note that most laboratories will not use special tubes for discard tubes. They will just use a duplicate of the tube that they are collecting first. This yellow top tube contains sodium polyethanol sulfonate, and this tube requires special antiseptic skin preparation to avoid contamination from the skin bacteria. Be careful, as there are two types of yellow top tubes. This one is first, and the other is collected last in the order of draw. The additive binds calcium and aids microbial growth. These tubes are sterile and are used for the culture of microorganisms, aka blood cultures. If you notice here, I'm going to highlight it here. So this number here, so all of these slides that have tubes on them will have a number listed in them, and that will tell you the correct order of draw for each tube. A blood culture tube is drawn first to avoid contamination from skin bacteria or from the additives or anticoagulants in the other tubes. SPS inhibits complement, phagocytes, and certain antibiotics, and aids in the recovery of microorganisms which are found in septic patients. So a patient who has blood cultures collected is usually in the emergency department or is an inpatient, meaning they're in the hospital. So it's unlikely that you would collect a blood culture on an outpatient, so somebody just coming in for routine blood work. So blood culture bottles or vials are used to detect aerobic and anaerobic bacteria that may be growing in the patient's bloodstream. So this condition is called bacteremia or septicemia. So these vials or bottles or tubes are sterile containers and contain anticoagulation properties to prevent the blood from clotting, as well as nutrient broth to encourage that bacteria, if present, to grow. There's an aerobic and anaerobic bottle, and are most often drawn as two sets of an anaerobic and aerobic bottle. So aerobic bacteria like to grow in an oxygenated environment, whereas anaerobic bacteria either don't require oxygen to grow or cannot grow in the presence of oxygen. So that's why we have two of these bottles, one that provides a great environment for aerobic bacteria to thrive, and one for those that are anaerobic. The light blue top tube is a commonly collected tube that is used for coagulation testing. The anticoagulant in this tube is called sodium citrate. It prevents clotting by binding calcium. There is a 9-to-1 ratio of blood to anticoagulant in these tubes. And because of this, these tubes must be filled completely or the sample will be rejected, as the ratio of blood to anticoagulant will not be correct and the test results will be invalid. So this is these tubes are used for tests that assess coagulation status. And so if the anticoagulation ratio is off in this tube specimen, the results are going to be all wrong. So the BD Vacutainer glass CTAD tubes contain buffered citrate, theophylline, adenosine, and dipyrimidine to obtain a citrate plasma sample where the in vitro heparin activity has been stabilized. So the CTAD tubes are used for specialized platelet studies. So these tubes must be inverted 3 to 4 times to ensure that they do not clot. And of course, in any of these light blue tops, if the sample clots, it will be rejected. The light blue black top tube also contains sodium citrate and would be in the same order of draw as the light blue tube. So this tube has a gel and density gradient liquid that is used to separate the mononuclear cells from the plasma or blood. So this is used for molecular diagnostic testing, and it's really not a commonly collected tube. The black top tube also has that anticoagulation sodium citrate, and it's also order of draw 2. It's used for Westergren erythrocyte sedimentation rates, or commonly called ESRs or WSRs, or just SED rates. And it has a 4-to-1 ratio of blood to additive. So some erythrocyte sedimentation rates use the purple top EDTA tubes, and of course that is dependent on what laboratory is performing the test, whether they use a black top tube or a purple or lavender top. This is a red, gray, or gold top. These are called serum separator tubes, or SSTs. The tube has a silica as a clot activator. This causes, of course, the sample to clot, and when centrifuged, the gel barrier within the tube will separate the serum from the red blood cells. So you can see in this photo on the right-hand side of the slide, the serum that is the straw color is on the top, then the gel barrier in the middle, and then at the bottom of the tube are the red blood cells. So just as a side note, any tube that is not anticoagulated will clot, and this removes fibrinogen from the plasma to form the clot. So when fibrinogen is removed from the plasma, it becomes serum. So this tube type is order of draw number 3. This is a red top tube with a silica clot activator, but it has no gel separator in it. So this can be used for chemistry tests that the gel might interfere with. The clot does not form quickly and can delay testing, and because of this, many labs use an anticoagulated blood sample and plasma, as they can be centrifuged and be ready to test more quickly. So this has to clot before it's centrifuged. So this is order of draw number 3. The orange top tube has the clot activator thrombin in it, and is considered a rapid serum tube. It can finish clotting within 5 minutes and can then be centrifuged for stat chemistry tests. The term stat means that the test is needed very quickly, usually within an hour from draw to result. So this can be used on patients who are receiving anticoagulation therapy. So this orange top tube is also considered order of draw number 3. This red-green top tube is a mononuclear cell preparation tube. It has the anticoagulant sodium heparin, a polyester gel, and a density gradient liquid. It's used for molecular diagnostics testing. This tube is order of draw number 4. Green top tubes come in 3 different types: sodium heparin, lithium heparin, and ammonium heparin. So the sodium heparin cannot be used when measuring a patient's sodium. The lithium heparin cannot be used when measuring lithium, and the ammonium heparin cannot be used when measuring ammonium because it contains those analytes, so it will falsely increase them. So all of these tubes have heparin in them, and heparin is an anticoagulant that works by inhibiting thrombin, which is a part of that coagulation cascade that we saw on a couple slides previous. These tubes are primarily used for chemistry tests and require a fast turnaround time, as they do not clot and can be centrifuged directly after they are drawn. Just like all the tubes that contain heparin, these green tops are order of draw number 4. This is the light green top, and this one has lithium heparin in it. and is one of the most commonly collected tubes in a laboratory. This one is a plasma separator tube and has an inert separation gel that separates the red cells from the plasma. So this is well suited for potassium measurement. This is order of draw 4, just like all of the heparin tubes. This is a lime green top that has lithium heparin and a mechanical barrier rather than a gel. This is used for zinc determination, which is not tested very often. Royal blue tubes have different anticoagulants depending on the manufacturer. They can be used for toxicology testing, trace metal analysis, and also nutritional analysis. When these have the anticoagulant sodium heparin in them, they are order of draw 4. And if they have potassium EDTA, they are order of draw 5. Collecting royal blue tubes after green tops and before other EDTA tubes will ensure that you have them in the correct order of draw. Remember, EDTA tubes should not be collected before the green top tubes with heparin. The lavender or purple top tube is one of the most commonly collected tubes. This tube has the anticoagulant ethylene diamine tetraacetic acid, or for short, EDTA. This anticoagulant works by binding calcium. These tubes are used in hematology because they maintain the cellular integrity of the red and white blood cells and also inhibit platelet clumping. These are used for complete blood counts and sometimes sedimentation rates. The lavender or purple top tube is order of draw number 5. The pink top tube is used in immunohematology, which is also known as blood bank. It may have special labeling requirements when it is collected since it's used for blood typing and cross-matching of compatible donor blood units. The pink is a commonly collected tube type. Now the white stopper tube here is a plasma separator tube and is used for molecular diagnostics testing. Both of these tubes have EDTA, and because of that they are order of draw number 5. The tan top tube might be used for healthy 1-year-olds or children when monitoring for lead poisoning. This tube also contains EDTA, and because of that is order of draw number 5. This is not a tube you will use anywhere near as often as the other EDTA tubes. This is the gray top tube, and it has 2 different additives. The anticoagulant is potassium oxalate that works by binding calcium, and the antiglycolytic is sodium fluoride. The antiglycolytic prevents the cells from using the glucose in the plasma, so this tube is suitable for glucose monitoring, lactic acid testing, and blood alcohol levels. This tube is order of draw 6. This is the second yellow top tube. It contains acid citrate dextrose, also known as ACD. This is used for cellular studies in blood bank and immunology such as HLA testing. HLA testing is used to match an organ transplant recipient with a compatible donor. The anticoagulant in this tube binds calcium and preserves red blood cells. It is order of draw number 7. Now this photo shows a urine collection system. As you can see from this picture, these tubes kind of look a lot like blood collection tubes. So be careful that you don't accidentally grab a urine tube. Notice the pointed bottom end of this yellow top tube. So this here is what we're talking about here. All right, so it's pointed, and a blood tube isn't going to have that. The gray tube states that it's for urine. It says it directly on there. This slide and the next one shows what tests can be affected by contamination from either carryover from the tube being collected in the wrong order, or when a person collects in one tube and then pours the specimen over into another tube. EDTA can affect many chemistry tests and is not appropriate for chemistry analysis. Depending on what is combined with the heparin in the green top tubes, it can affect that test. So for example, a lithium heparin tube cannot be used to run a lithium level on a patient. So both anticoagulants, EDTA and heparin, are not appropriate for coagulation studies. The light blue top is used for coagulation studies and must always be collected before EDTA or heparin tubes. So this slide lists additional tests that will be inaccurate if there is contamination of EDTA or heparin. This of course is a long list and illustrates the importance of collecting tubes in the proper order of draw. Following the correct order of draw prevents the anticoagulation transfer between tubes. EDTA and heparin can falsely increase coagulation studies. This would make the patient appear to not be able to clot properly when it's not true, obviously. Heparin will also affect the properties of serum and can cause invalid results. EDTA also affects chemistry tests due to the fact that it contains potassium and also binds calcium. Additionally, proper order of draw is important to prevent contamination of sterile specimens. So for example, blood culture bottles are always collected first because they need to be kept sterile. They cannot be contaminated with bacteria from equipment, your skin, or the patient's skin, as this will cause a false positive result and tell the patient's physician that they have a bacterial blood infection, which of course is not correct. The bacteria came from the contamination and not the actual patient's blood. The order of draw recommended by the Clinical Laboratory Standards Institute, or CLSI, is 1. Blood cultures, 2. Light blue tops, 3. Red, gray, or gold, red, orange, red, royal blue, 4. Green or light green, royal blue with heparin, 5. Lavender, pink, white, royal blue, and tan, anything that contains EDTA. 6. Gray, which contains sodium fluoride and potassium oxalate, and 7. Yellow, that has ACD in it. It's important to note that the additive or anticoagulant is what determines the order of draw. If two tubes have the same additive, they can be collected one after the other. A syringe is good for smaller veins. This is because it allows for manual control of the suction pressure. The barrel can hold from 2 to 20 milliliters, and the needle used with the syringe is called a hypodermic needle. When selecting a syringe for use, you should use one that holds more than what you need, but the one closest to the amount you need. The photo on the right-hand side of this slide shows you what a syringe looks like. Like with other needles used for venipuncture, a syringe hypodermic needle must have a safety shield that should be activated by using a table or other hard surface. It can be 21 to 23 gauge and 1 to 1.5 inches in length. The photo on the right-hand side of this slide shows the phlebotomist activating the safety shield against a hard surface using a syringe. So this is how the evacuated tube system and using a syringe to draw blood differ. In the evacuated tube system, the blood goes directly into the tube. In the syringe method, the blood has to be transferred from the syringe into the tubes. A transfer device allows you to safely transfer blood from the syringe into a tube. The needle is activated, removed from the syringe, and placed in the sharps container. Next, the transfer device is connected to the syringe, and the syringe should be up and the transfer device down to keep any air at the top. Add the tubes into the transfer device in the correct order of draw. Allow the vacuum in the tubes to pull the blood into it. Never press on the plunger, as this will hemolyze the sample and create problems. The photo on the right-hand side of the slide show how this is performed. For the syringe method, the CLSI recommends the same order of draw as when using the evacuated tube system method. Wing blood collection sets, also known as butterflies, are used for very small veins. They have a gauge from 21 to 23, a length of 0.5 to 0.75 inches, are attached via flexible tubing to either a syringe or an evacuated tube system holder. A discard tube is used with the ETS to draw in the air before collecting the tubes. You must account for this air in the tubing when deciding what size syringe you need based on the volume used for testing. A tourniquet is a non-latex band used to impede venous but not arterial blood flow. The tourniquet is used to make the vein more prominent and easier to find. In the clinical site, these are single-use and disposable. A blood pressure cuff may be used in some cases, like in blood donation, when patients are donating their blood for donated transfusions. The picture on the right-hand side of this slide shows a phlebotomist drawing blood with the tourniquet present. The tourniquet is this bluish purplish band above the draw site. So this here is the tourniquet. There are vein locating devices that might be helpful in locating non-visible veins. They use high-intensity LED to detect veins. They are not commonly used in a clinical lab setting, but they do exist. Gloves are mandated by OSHA's bloodborne pathogen regulations. The gloves we use are non-sterile, need to properly fit, are powder-free, and also need to be non-latex. If latex gloves are used for any type of procedure, you must ask the patient if they are allergic to it. Most hospitals do not allow latex in the building due to the risk of anaphylactic reaction in patients that are exposed to it. The puncture site must be cleaned with an antiseptic. The antiseptic used for routine venipuncture is 70% isopropyl alcohol, which is bacteriostatic, which means it prevents the growth of bacteria. When collecting blood cultures or donor blood units, iodine or chlorhexidine gluconate must be used as a stronger antiseptic. If using iodine, the phlebotomist must ask the patient if they are allergic to iodine. And of course, iodine should never be used on someone if they have an allergy to it. The procedures dictated by the laboratory draw site will offer an alternative. After the needle is removed, a 2 by 2 inch gauze pad is used to apply pressure to the venipuncture site to stop the bleeding. The patient can be asked to hold pressure while the phlebotomist labels the tubes. Of course, this is if they are in an outpatient setting and the patient is capable. If an inpatient is too weak to do this, the phlebotomist must hold pressure until the bleeding stops and then secure with a bandage or wrap. If Band-Aids are used, they should be non-latex, but cannot be used on older people who have thin skin or people who react to adhesive. There is a non-latex self-adhering bandage wrap, which might be called Coban or Coflex, depending on the manufacturer. Instruct patients to leave it on for about at least 15 minutes before removing it. Patients on blood thinners may need to wear it longer as they are more liable to bleed. Additional supplies for the phlebotomy procedure may be biohazard transport bags. So this allows for medical waste that is not sharp to be properly discarded. An alcohol-based hand sanitizer to help sanitize hands. A ballpoint pen to properly label the tubes without the ink bleeding. And also a label printer can be used to print off labels with the patient's identification and tests that are ordered. To ensure the quality of equipment, always ensure that it has intact packaging before use. Make sure the needle caps have not been opened, and of course inspect the needle for defects before using. This inspection is done right before the needle is inserted. The needle must be checked for any defects, so if it is defective, it needs to be properly discarded and a new needle used for the procedure. Also, you cannot use tubes past their expiration date. If the tube is out of date, it may not get a full draw due to no vacuum, the anticoagulant may not work, the specimen won't be preserved properly, or the gel barrier may not work. It's very important that phlebotomists and other laboratory professionals adhere to expiration dates.